Welcome, curious minds, to another deep dive. When we think about the heart, it's often seen as this incredible symbol, right? Love, courage, all our deepest emotions. But beneath all that poetry, it's also just an amazing pump. Really complex, powerful, working nonstop. So what happens when the actual muscle of this vital organ, its engine you could say, starts to get sick? Today we're diving deep into cardiomyopathy. Okay, I admit it sounds a bit technical, a bit textbooky. But our mission, like always, is to unpack your sources, take that stack of medical info, and turn it into something clear, something useful, give you that shortcut to really feeling like you get it. We're going to explore what cardiomyopathy actually is, the different types, what causes them, and importantly, how these conditions are spotted and managed. And stick around, because we've got a really surprising twist later on, something called broken heart syndrome. It's way more than just a saying. Fascinating stuff. Okay, so to really get cardiomyopathy, we need to start with the basics. What actually is it?
Your sources say it's like a general term for diseases hitting the heart muscle specifically. So the walls of the heart chambers might get stretched out, or maybe they thicken up or even get stiff. And when that happens, it messes with the heart's main job, right? Pumping blood effectively around the body. Sounds pretty critical. What's the expert view here?
Well, what's fascinating, I think, is just how varied the causes can be. A lot of types are inherited, passed down through families. But it's not just genetics. It can also pop up because of other health problems someone has, or lifestyle factors. Even certain viral infections you wouldn't necessarily connect to the heart. And really importantly, for quite a few people, the doctors actually don't know the exact cause. It's a bit of a medical mystery sometimes. And another key thing, it can affect anyone, all ages, children, adults. It doesn't discriminate.
Wow, okay, that does sound like a complex picture. So how do we start to sort of categorize it, break it down?
Yeah, it helps to think about four main types. Each one affects the heart's mechanics, how it works in a different way. Let's start with dilated cardiomyopathy, DCM.
DCM.
Yeah.
Right. So with this one, the heart muscle walls get stretched and thin, which I guess makes them weaker, less able to squeeze properly and pump the blood out, kind of like an old stretched out elastic band.
Exactly. And that stretching, that thinning, makes it quite serious. If you have DCM, you're definitely at a higher risk of developing heart failure. That's where the heart just can't pump blood effectively enough for the body's needs. And the common signs of heart failure, things like feeling short of breath, really tired all the time, maybe swelling in your ankles, those are key symptoms. Plus, there are other risks too, like problems with heart valves, irregular heartbeats, even blood clots forming. So yeah, keeping in regular touch with your GP or a specialist is absolutely vital. You need that monitoring.
It really sounds like you could be triggered by so many different things. You mentioned that medical mystery aspect. Your sources list a huge range of potential causes beyond just inheriting a faulty gene. What else can lead to DCM?
Oh, it's quite a list, yeah, which really underlines the complexity. So apart from genetics, you've got things like uncontrolled high blood pressure, putting strain on the heart over time, or existing problems with the heart valves. Lifestyle definitely comes into it too. Things like not getting enough essential vitamins or minerals, drinking too much alcohol, or using recreational drugs, even viral infections. If a virus causes inflammation in the heart muscle, that can sometimes trigger DCM. And then there are these other sort of broader diseases, conditions affecting tissues or blood vessels elsewhere in the body. Things like lupus or sarcoidosis, where the immune system might attack healthy tissue, or less commonly conditions like granulomatosis with polyangiitis or polyarteritis nodosa. Your sources mentioned those specifically.
Oh, those sound quite specific. And wasn't there one linked to pregnancy as well?
That's right, yes. Peripartum cardiomyopathy. It's rare, thankfully, but it can develop sometimes during pregnancy or in the first few months after giving birth. But, even with this huge list of potential causes, for many people, the why behind their dilated cardiomyopathy just stays unknown, which makes diagnosis tricky sometimes.
That complexity really comes through. Okay, so if DCM is about stretching and thinning, the next type, hypertrophic cardiomyopathy, HCM, that sounds like the opposite.
It is, yeah, completely different mechanism. With HCM, the heart muscle cells actually get bigger, they enlarge, and this causes the walls of the heart chambers, particularly the ventricles, the main pumping chambers, to thicken up. Now, this thickening shrinks the space inside the chamber so they can't hold as much blood. Plus, the thickened walls become stiff, they can't relax properly between beats, and sometimes the thickened wall can even bulge out and block blood flow out of the heart.
Okay, that sounds just as worrying, just in a different way. So what's the impact for someone with HCM?
Well, this is where it gets really paradoxical. For most people with HCM, it actually has little or no impact on their daily life. Many have no symptoms at all, might not even need treatment.
Really? No symptoms?
Often, yes. But, and this is a huge, but for a small group, it's incredibly serious. It's actually the most common cause of sudden unexpected death in childhood, and particularly in young athletes. So the key thing here is that no symptoms doesn't automatically mean no risk. It's tricky. The stiffness can cause pressure to build up backwards into the smaller collecting chambers, worsening potential heart failure symptoms. It can lead to abnormal heart rhythms like atrial fibrillation. You can get that reduced blood flow we mentioned that's obstructive HCM, or a leaky mitral valve, even a higher risk of heart infection, endocarditis.
Wow. That's a stark reminder, isn't it? That someone can seem perfectly healthy but have this hidden risk. So if symptoms do show up, what should people look out for?
The common ones are things like dizziness, chest pain, feeling breathless, or sometimes even fainting, a temporary loss of consciousness. It's estimated to affect about 1 in 500 people in the UK, so it's not super rare. And mostly, it is inherited. Doctors will definitely talk to you about exercise levels, what's safe, and any lifestyle changes needed if you're diagnosed. They might advise against, say, really high-intensity competitive sports if the risk is higher, even if you feel completely fine.
Okay, so we've had the stretched heart of DCM, the thickened heart of HCM. Now we move to something different again, restrictive cardiomyopathy, or RCM. You said this one's the rarest.
That's right, much rarer than the others. With RCM, the problem is stiffness. The walls of the main heart chambers become stiff and rigid. They lose their flexibility, so they can't relax properly after they contract. This means the heart struggles to fill up properly with blood between beats. Imagine trying to fill a really stiff, unyielding container. It just can't expand to take in much volume. And the result? Reduced blood flow from the heart, which again can lead to those heart failure symptoms, breathlessness, tiredness, ankle swelling, and it can cause heart rhythm problems too. RCM is diagnosed most often in children, interestingly, but it can develop at any age. And like the others, the cause is often unknown, but sometimes it can be inherited.
Got it. Okay, let's tackle the last main type, arrhythmic cardiomyopathy, ACM. The name itself kind of gives a clue, right? Arrhythmia, rhythm problems.
Absolutely it does. This is an inherited condition, and it primarily affects the ventricles, the lower pumping chambers. And it has a really unique pathology, a specific problem at the cellular level. The proteins that normally act like glue, holding the heart muscle cells together, they're abnormal in ACM. So this leads to the muscle cells actually dying off. And what replaces them? Fatty tissue and fibrous scar tissue. The result is that the heart chamber walls become thin and stretched, a bit like in DCM, but for a different reason, and they just can't pump blood effectively. And crucially, as the name suggests, people with ACM usually have significant heart rhythm problems, those abnormal electrical signals. Plus, the poor pumping can lead to heart failure symptoms. If we connect this to the bigger picture, it tends to affect teenagers and young adults. And tragically, it has been linked to some of those sudden unexplained deaths in young athletes we mentioned earlier. And there's growing evidence now that doing a lot of prolonged, really strenuous exercise can actually make the symptoms of ACM worse, which makes it absolutely critical for anyone who has ACM or might be at risk to have a really detailed chat with their heart specialist about what level of activity is safe for them.
Okay, so we have these 4 distinct types dilated: hypertrophic, restrictive, rhythmogenic, each affecting the heart muscle differently. How do doctors figure out which one someone has? What's the diagnostic process like?
Well, it involves a range of heart scans and tests. Your sources list the common ones: an ECG, electrocardiogram, to check the heart's electrical activity; an echocardiogram, which is an ultrasound of the heart, to see its structure and how well it's pumping. An MRI scan can give really detailed pictures, too. Sometimes heart rhythm monitors are used. You wear them for 24, 48 hours, or even longer to catch any irregular heartbeats. An exercise test to see how the heart performs under stress. But for the types that are often inherited, a really important tool is a detailed family tree. Specialists will map out the family's health history meticulously, and then if they suspect an inherited type, genetic testing can sometimes pinpoint the specific faulty gene responsible.
Right, that genetic testing aspect sounds incredibly powerful. The idea you could find the exact gene and then test other family members.
Yeah.
That could allow for really early intervention, couldn't it?
Absolutely. It's a huge benefit. It means relatives can find out if they carry the same mutation before they develop symptoms, potentially. And if they do, their condition can be monitored closely, managed early on, possibly preventing serious complications down the line. It's a really impactful use of genetic information.
I imagine there must be some sensitivity around that, though. Telling a whole family they might carry a gene for a heart condition, how's that handled?
Oh, definitely. It's a very sensitive area. Genetic counseling is a crucial part of the process. Specialists are trained to explain the implications clearly, supportively. It's all about providing information, empowering families with choices about testing and management, not just dropping a diagnosis on them. It's handled with great care.
That proactive approach makes sense. Okay, so moving on to treatment. You mentioned there isn't usually a cure, as such, for the underlying cardiomyopathy. But the treatments we have are pretty good at controlling symptoms and stopping complications.
That's generally true, yes. Treatments can be very effective, and early diagnosis really helps with that. It's also worth remembering not everyone with cardiomyopathy will actually need active treatment. If it's a mild form, sometimes just making sensible lifestyle changes is enough to manage it.
Right, lifestyle changes.
Mhm.
That seems to be a cornerstone for a lot of heart conditions. What kind of things are we talking about here?
Well, whether the cause is genetic or something else, these changes are often the first step. Things like eating a healthy, balanced diet, doing gentle, regular exercise. The type and amount needs careful discussion with your doctor, of course. Quitting smoking is a big one, losing weight if you're overweight, avoiding excessive alcohol, or maybe cutting it out completely. Getting enough sleep is important too, and if you have sleep apnea, getting that treated. Managing stress, and making sure any other conditions you have, like diabetes or high blood pressure, are properly controlled. These things really can make a difference to how the heart copes.
And if lifestyle changes aren't quite enough, or maybe for more severe cases, medications come into play.
Yes, absolutely. Medicines are often used alongside lifestyle changes. They can help control blood pressure, correct those abnormal heart rhythms we talked about, help the body get rid of excess fluid if heart failure is developing, or prevent blood clots. So common examples are things like beta blockers, ACE inhibitors, diuretics, and anticoagulants, blood thinners like warfarin, for instance. The specific meds depend very much on the type of cardiomyopathy and the symptoms.
Okay, and beyond lifestyle and meds, are there more invasive procedures for specific situations?
Yes, for certain cases, hospital procedures might be needed. For example, with obstructive hypertrophic cardiomyopathy, where that thickened septum muscle blocks blood flow. There are a couple of options. One is an alcohol septal ablation, where a tiny amount of alcohol is injected to carefully shrink part of that overgrown muscle. Or there's surgery called a septal myectomy, where a surgeon actually trims away some of the thickened muscle. Sometimes they might repair the mitral valve at the same time if it's leaky. And for those tricky heart rhythm problems, doctors might perform an arrhythmia ablation. That uses heat or cold energy to carefully create tiny scars on the heart tissue to block the faulty electrical pathways. Or they might implant devices, pacemakers, to help regulate a slow or irregular heart rate. Or ICDs, implantable cardioverter defibrillators. These are clever devices that monitor the heart rhythm constantly and can deliver an electrical shock to correct a dangerous, life-threatening rhythm if one occurs.
Right, those sound like quite significant interventions. And I suppose if all else fails in the most severe situations.
Then, yes, as a very last resort, when the heart muscle is severely damaged and other treatments aren't working, a heart transplant might be considered.
Okay. Phew, that's a lot on the main types.
I know.
Let's get to that twist you mentioned earlier, this broken heart syndrome.
Yeah.
Medically, Takotsubo cardiomyopathy, or acute stress cardiomyopathy. It sounds, well, almost poetic, doesn't it? But it's real.
Oh, it's absolutely real and fascinating. Think of it as a temporary heart problem that some people experience after a major emotional or physical stress, like the intense grief after losing a loved one, or the physical stress of major surgery, or even extreme fear or shock. What's really striking here is that direct link. A profound emotional event causing a physical problem with the heart muscle. The muscle suddenly becomes weak or sort of stunned. And this causes the left ventricle, that main pumping chamber, to actually change shape temporarily. It balloons out at the bottom. And the thinking is this is triggered by a massive surge of stress hormones, especially adrenaline, flooding the system during that intense stress period.
Wow, so it's not just a figure of speech. Our emotions can literally, physically affect the shape and function of our heart. That kind of changes how you think about heart health.
It really does. It moves beyond just thinking about plumbing and mechanics, doesn't it? It brings in our whole psychological state. Now, the main symptoms are chest pain and breathlessness. And here's the critical thing. Those symptoms are basically identical to a heart attack. That's why, if you or someone else suddenly gets symptoms like that, you must treat it as an emergency. Call 999 or your local emergency number immediately. Don't wait.
Okay, Absolutely vital message. And what else do we know about it? Is
Yeah.
it common? Does it cause permanent damage?
It seems to be more common in women, particularly postmenopausal women, though it can affect men and younger people too. But here's the generally good news. It's usually temporary. The heart muscle typically recovers and the condition is reversible. And it's actually quite unusual for someone to experience it more than once. It's just this incredible, though sometimes scary, illustration of that powerful connection between our minds and our bodies. How linked our emotional health and physical health really are.
And that feels like a really powerful place to wrap up our exploration today. We've covered a lot of ground, haven't we? We've journeyed into cardiomyopathy, starting with what it actually means, exploring those different forms: dilated, hypertrophic, restrictive, and arrhythmogenic. Really trying to understand their unique features, what causes them, how they impact people, right down to that incredible story of broken heart syndrome. We really hope this deep dive has helped clarify things, maybe give you a few of those aha moments, help you feel properly informed about these complex heart conditions without feeling, totally overwhelmed by the medical jargon.
And perhaps to leave you with a final thought to mull over, we've seen this huge range of causes, right? From genes we inherit to how we live to even intense emotional stress, and yet for so many cases the origin is still unknown. So the question maybe is, what other secrets is the human heart holding on to? What more is there to learn about how it connects to our genes, our environment, and even our deepest feelings?
It's definitely something to think about. Thank you so much for joining us on this deep dive. Until next time, keep exploring, keep asking questions, and keep
For
learning.
more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.